So when someone is told you should wait as long as possible so you don't have to do this twice, the question becomes, what's the trade-off? Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle. If you've been told you might need a knee replacement, there's a good chance you've also heard this warning at some point. You don't want to do it too early because it only lasts about 10 years. That idea tends to stick, and it shapes decisions. One thing we see in the research is that many patients still expect a knee replacement to last only about 10 years, even though long-term data shows otherwise. It leads people to wait, sometimes for years, even when pain is increasing and function is declining. By the end of this episode, you'll understand what implant longevity actually looks like based on current research, and how you might think about timing in a way that's grounded in evidence rather than maybe a little fear. The idea that a knee replacement only lasts 10 years did not come from nowhere. And I'm wondering, is that a double negative? Earlier generations of implants and surgical techniques did have more limited longevity compared to what we see today. Materials were different, fixation methods were different, and surgical precision was different. So historically, there was a real reason for caution. But the problem is that this number, 10 years, has persisted long after the evidence has changed. And modern knee replacement outcomes tell a very different story. A large systematic review published in The Lancet by Evans and colleagues followed patients over time and found that most knee replacements are still functioning well at 15 years. In that analysis, approximately 9 out of 10 knee replacements were still functioning at 20 years. In fact, long-term registry data, including recent reports from large national joint registries, demonstrate that many implants are still functioning successfully at 15, 20, and even 25 years after surgery in long-term studies. I've also personally met people whose knee replacements have lasted that long, which helps put those numbers into perspective. It doesn't mean every implant lasts that long, but it does mean that the 10-year limit is no longer accurate. One of the most helpful ways to understand this is to understand how researchers actually report these outcomes over time. Instead of focusing on a single number, they track what percentages of implants are still functioning at different time points. For example, in that same body of research, about 90 to 93% of knee replacements are still functioning at 15 years, around 90% at 20 years, and just over 80% at 25 years. So when you look at those numbers together, a clear pattern emerges. Most knee replacements continue to function well for a long time, and a large percentage are still doing well even 2 decades after surgery. So the question shifts. It's no longer, will this only last 10 years? It might become, what are the chances that this will last a long time for me? And that's a much more useful question because implant longevity is not determined by a single number. It's influenced by a combination of factors. Surgical technique plays a role, implant design plays a role, and importantly, people-related factors also play a role. Activity levels, strength, movement patterns, and overall health all influence how load is distributed through the joint over time and are strongly related to function and how people feel and move after surgery. Current research does not consistently show higher revision rates in more active individuals, although activity type and overall loading patterns are still considered. This is where the conversation starts to shift from concern toward understanding. Another important piece is how failure is defined in research, and it's not what some people think. In most studies, implant failure is defined as the need for a revision surgery. That means that even if someone has some discomfort, stiffness, or changes over time, it does not necessarily mean the implant has failed. It only counts as failure if the joint needs to be replaced again. Many people continue to have a functioning implant for decades, which helps explain why long-term outcomes remain strong. At the same time, it's also important to acknowledge that revision surgeries do happen, even if they are less common than most people might expect. Implants can wear over time. Components can loosen. Infections, unfortunately, can occur, and changes in surrounding bone or tissue can affect the joint. Research shows that earlier failures are more often related to infection or instability, while later failures are more commonly due to loosening rather than simple wear. But these outcomes are far less common than many people expect when they hear the 10-year message. And importantly, the risk of a revision is not evenly distributed across all patients. Younger patients, for example, may place higher demands on the joint over a longer period of time, which can influence long-term wear patterns. But even in younger populations, outcomes have improved with modern implants and techniques. And when researchers look at lifetime risk, population-level studies suggest that many people who have a knee replacement later in life may never need another surgery. So when someone is told you should wait as long as possible so you don't have to do this twice, the question becomes, what's the trade-off? This is a question for you and for your surgeon. I'm certainly not trying to talk anyone into having a surgery. You need to make an informed decision for yourself. Also, think about this. Waiting is not always neutral. Delaying surgery often means spending more time with pain, reduced activity, and declining strength. And those factors can influence what happens after surgery. Of course, again, the decision is yours to make. I often see patients who have been told to wait as long as possible, so they continue managing increasing pain for years. By the time I see them, walking is more limited, strength has declined, and everyday activities take more effort. From their perspective, I believe that they were trying to make the right long-term decision, but it often makes the early phase after surgery more challenging. We talked about this in episode 35, Can You Wait Too Long for a Knee Replacement? The real trade-offs between waiting, function, and recovery, where we explored how delaying surgery can influence both function and what the early phase after surgery looks like. Go ahead and check out that episode if you haven't listened to it already. Research has consistently shown that pre-operative strength and functional ability are associated with post-operative outcomes. In addition, studies show that most measurable improvements in function occur within the first few months after surgery, which highlights how important that early period can be. In other words, how you go into surgery can influence how you come out of it. If someone waits until their mobility is significantly limited and their strength has declined, the healing process after surgery can be a bit more challenging. And that doesn't mean you can't have a good outcome, but it does mean that waiting may have some natural consequences. So instead of thinking only about how long an implant lasts, it may be more useful to think about overall quality of life. What are you able to do right now? How is pain affecting your daily activities? And how is it influencing your ability to stay active, maintain strength, and participate in the things you enjoy? Those questions are just as important, I believe, as implant longevity. Another important shift in thinking may be understanding that revision surgery, while it's not ideal, is also not the same as starting over from the beginning. Outcomes are variable, but many patients still achieve meaningful improvements in pain and function. So even in the less common scenario where a revision is needed years down the line, it is not necessarily a catastrophic outcome. It's a part of the longer-term management of a joint condition. This perspective can help reduce the sense of urgency around trying to time it perfectly, because the reality is that there is no single perfect moment, only a decision that you make that balances current quality of life with long-term considerations. And when you look at modern data, the long-term outlook is far more favorable than many people have been led to believe. It's also worth recognizing that implant technology continues to evolve, and that progress continues to improve long-term outcomes. Materials have improved, surgical techniques have become more precise, and rehabilitation approaches are more refined, all of which contribute to better outcomes over time. So the data we have today reflects earlier generations of implants, and outcomes may continue to evolve as technology advances. I know that the therapy techniques have certainly improved after knee replacement. Now, this doesn't mean guarantees, but it does mean that the trajectory is moving in a positive direction. So when you hear that a knee replacement only lasts 10 years, it's helpful to pause and reframe that statement. It may have been based on older data, and it may have been intended to encourage caution, but it doesn't reflect what current research actually shows. A more accurate way to think about this is many knee replacements last well beyond a decade, and a large percentage continue to function successfully for 15 to 20 years or more. The factors that influence outcomes over time are broader than just the implant itself. They include how the joint is used, how strength is maintained, and how movement patterns evolve over time. When you understand that, the decision becomes less about avoiding an arbitrary number of years and more about making an informed choice based on your current situation, which is ultimately what drives better outcomes. And that's a much more empowering place to be because it shifts the conversation away from uncertainty about the future and toward understanding the present. One of the biggest challenges with knee replacement is knowing what information actually applies to you right now. And that's exactly why I created the Total Knee Success Insider. It's completely free, comes straight to your inbox, and it's built to follow you through your entire journey with education tailored to your specific stage. Maybe you're considering, or you're just before surgery, early recovery, or later phase strengthening. Instead of trying to piece things together, you'll receive focused, relevant information that supports your next steps. If you want information that's actually relevant based on where you are, you can head to the show notes and subscribe to the Total Knee Success Insider. In the next episode, we're going to take that idea one step further. We'll look at what actually impacts your outcomes after knee replacement. Because it's not just the surgery itself. We'll walk through the factors that have the biggest influence on how you move, how strong you feel, and how well you function over time. And remember, how you go into surgery can influence how you come out of it. Thanks for joining me. I'm Michelle, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com and be sure to subscribe and share because every step forward takes you closer to living the life you love.